Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department to give our weekly update on COVID-19. As we've seen nationally and in other parts of the state, the numbers starting to stabilize and even come down a little bit on total case numbers. But what we do see, and Dr. Bogan will report this out, is the hospitalizations and fatality numbers that tend to lag and tend to be a little bit different as we move forward. The one thing that has not changed and has really even strengthened over time is the effectiveness of vaccines. We know the vaccines work. And week after week, month after month, the data is irrefutable in how effective they are in protecting all of us. We are seeing more and more people become vaccinated, which is good. We'd like to see that case go up a little bit higher, a little bit quicker, but the fact is we are seeing people, more and more people who are listening to our experts like Dr. Bogan and other health experts who have told us good medical advice. So with that, let me turn over to Dr. Bogan. Dr. Bogan.
Thank you, County Executive. Good afternoon. Today I have both good and bad news. First, the good news. Cases are dropping nationally, and in Allegheny County, although we still are seeing an average of about 350 to 400 cases a day, I believe our case numbers have plateaued and we may be seeing a slight decline in cases. Now the bad news. Hospitalizations continue to increase, but this is expected as hospitalizations generally lag about 2 weeks behind, or a couple of weeks behind cases. But more importantly, and sadly, deaths are higher than they've been in months. In September, 90 people died of COVID-19 in Allegheny County, which is the highest monthly number since 91 people died in April of this year. What pains me most is that many, and probably most, of those deaths could have been prevented, but misinformation is literally killing people. I hear from the medical staff that when they take care of people who are in the hospital with COVID-19, that most chose not to get the vaccine because of misinformation. They, quote, did their own research. As someone who's conducted clinical research and worked alongside countless others who have too, I'm going to push back on that statement. Reading Facebook, Instagram, Twitter, or blog posts is not doing your own research, nor is getting your information from websites that spread misinformation or endorse conspiracy theories. I encourage you to read the primary sources of research data, including sources like the Morbidity and Mortality Weekly Reports from the CDC, the New England Journal of Medicine, the Lancet, Pediatrics, and other scientific literature that require a peer review process to publish. The peer review process holds people accountable for what they publish, which social media and the internet do not. My brother sent me a cartoon recently that said that healthcare facilities are going to replace doctors with parents who use the internet to answer your questions. Unfortunately, there is more truth in this cartoon than I would like, but that's where we are these days. Healthcare providers and scientists around the world have conducted research and provided their findings that overwhelmingly demonstrate that the COVID-19 vaccines are both safe and effective. Over 6 billion doses have been administered worldwide for everyone to see. They are an incredible gift from science and scientists, but because some people have been fed bad information, usually on the internet, they opt out. It's essential that we listen to the people's concerns and correct that misinformation they've received. For example, that vaccines will impact future fertility, or that ivermectin can prevent COVID. These are false. Vaccines do not cause infertility, yet this is a lie that's been used by the anti-vaccination movement for years to scare people. With regards to ivermectin, not only does it not work, nationally there has been a significant increase in calls to poison control and visits to emergency departments for ivermectin overdoses. In this case, misinformation has led to direct harm. Like ivermectin misinformation, vaccine misinformation has led to preventable deaths from COVID-19. Here are a couple of sobering facts. Since September 1st, in Allegheny County alone, 9 people aged 25 to 49 died from COVID-19. None of them were vaccinated. In the 50 to 64 age group, 16 people have died since September 1st. Of them, 13 were not vaccinated. These are young people, all of them taken way too early. They leave behind heartbroken families and irreplaceable voids in their communities. And in most cases, they simply did not need to die. In most cases, had they gotten the vaccine, they would still be alive today. It pains me that we continue to report weekly deaths from COVID-19 when we have the means to prevent nearly all of them. As the director of the health department, as a pediatrician, as someone who deeply cares about our community and individuals, please listen to the data and get vaccinated. If you don't trust me, fine, call your healthcare provider and have a discussion. Share what you've read and what's worrying you. I urge you to check your sources, do the research on them. And with that, I'll end. Thank you, be safe, and be kind.
The first question that we have today is from Public Source. How many pediatric COVID-19 cases have been reported daily over the past week, and how does that compare to the trends in pediatric cases over the past few weeks?
I just remind people that this data is put out in our daily report, so you can find it there. But I think in the past 7 days, we've had 89 cases, 0 to 4, 257, 5 to 12, and 161 in those ages 13 to 18. We have definitely seen an increase in pediatric cases in our community since schools opened, and that's been a trend seen across the country.
This next question, also from Public Source. Is the county concerned about the onset of flu season, especially among children, as a result of in-person learning?
We worry about flu every fall and winter. We had a very quiet flu season last year, but this year we're concerned that it will be quite high and there'll be a lot of cases. So we're strongly encouraging everyone to please go get their flu vaccine. The flu vaccines are in at the pharmacies. They're available in our immunization clinic. Our doctor's offices have them. So please go, it's time, go get your flu vaccine.
This next set of questions is from WESA. State data shows that some 2,700 Allegheny County residents have received their first dose of the COVID vaccine since the start of October. Though the county health department administers just a fraction of the COVID vaccines given in the county, do you have a sense of why some people are choosing to get vaccinated now?
I think for a couple reasons. I think as we've seen the effectiveness of the vaccine, and again, week after week, the data nationwide and locally both show the effectiveness of it. Dr. Bogan gave some very startling statistics about recent fatalities among young people and among the unvaccinated. But I'm also hearing anecdotally many companies, and I've spent the last couple of days with a couple of larger companies in Allegheny County, I won't give their names, in which they've got a mandate that, or a requirement, I should say, that all of their employees become vaccinated. They don't put it out there very publicly. It's not been in the news, but I'm seeing more and more of this of companies that are in the high 90s of a percentage of their employees who are vaccinated. They feel more comfortable, they feel safer, they feel in a much better place when their employees are becoming vaccinated. So we're seeing more and more of that. And I think we've also seen among our college students in the college and the universities in Allegheny County, well in the 90s, above 95%, most of them. So I do think you're starting to see places where just about everybody is vaccinated, and that's pushing those numbers up.
Has there been an increase in county employees getting vaccinated since the vaccine requirement was announced?
Well, we've had a couple of announcements. Back in mid-August, we announced that any new employees had to be vaccinated, and that unvaccinated existing county employees had to be tested regularly and be masked regularly. When that first announcement came out, we did see an increase in many of the county employees becoming more of them becoming vaccinated. And then since the announcement of a week ago, anecdotally, yes, we've seen that there have been more people going to get their vaccine shot. Of course, we have until December 6th for employees of Allegheny County to become vaccinated, and we are hearing more and more of them are becoming vaccinated.
This next question is still from WESA. When considering both vaccinated residents and those who have recovered from COVID, is Allegheny County's population approaching herd immunity?
Well, that's a hard question to answer because herd immunity is challenging to define. I don't think we have the data to know what percentage of the population we need with this particular virus to know what will be herd immunity. So I'm just going to remind, the more people we have vaccinated, the better. And I'll also remind people that vaccine immunity, that is immunity you get from the vaccine, is better and lasts longer than the immunity you get from natural infection. So I strongly, again, encourage everyone to go get vaccinated so we can reach herd immunity when we know what that is.
This next question is from WTAE. With flu season underway and many people still needing to get COVID-19 vaccinations, what is your advice on how people should space out getting a flu shot and a COVID-19 shot?
You can get them at the same day, so I encourage people to do that. As I say, get one in one arm, one in the other, and be done. One visit to your pharmacy or your healthcare facility, your grocery store, wherever you get your vaccines, go get them done at the same time.
As children are preparing for Halloween and trick-or-treating, what is the advice of the health department on how those children can stay safe?
This is the same advice we've been giving now for about 18 months. Wear a mask. Keep hand sanitizer around, clean your hands. Hold parties outside. Keep physical distance, limiting your size of your parties, etc. So no new advice, just the same old, same old. We're still at it.
This next question is from both WTAE and Post-Gazette. Last week, the CDC urged pregnant women to get the COVID-19 vaccine. Does the health department make the same recommendation? And what is the county seeing in terms of COVID cases among pregnant women?
So absolutely, we strongly support that pregnant women should be getting the COVID vaccine. The data are really strong that the vaccine is safe during pregnancy and it prevents adverse outcomes of pregnancy from infection with COVID. So both pregnant and nursing people should get vaccinated. We don't have data specifically on pregnancy here in Allegheny County. At least we don't have a linkage between pregnancy and vaccination. So that's not tracked in our vaccine database, so I can't comment about the numbers here.
This next question is from the Post-Gazette. Part of it you've already addressed, but is the county anticipating an increase or decrease in COVID cases and deaths in the month of October?
Yeah, so I've already talked about cases. I do think we've plateaued. I hope our cases are starting to go down. In terms of deaths, because they lag behind cases, I don't know if we're done seeing sort of that, if we're at the peak or if we have a couple more weeks of high levels of deaths. Again, I don't know. We'll have to wait and see.
Also from the Post-Gazette, how many booster vaccines have been administered in the county?
So this data is on the Pennsylvania COVID vaccine dashboard, and when I last checked, there were about 29,000 booster doses listed on the Pennsylvania COVID vaccine dashboard, but I would check with the state on those data more specifically.
And this final question, also from the Post-Gazette, are any other county branches or offices expected to announce vaccine mandates?
I do anticipate, we do hear that the other row officers in the courts are certainly looking at that and have been very supportive of the employees under the administration in doing that. So I fully anticipate that other offices will do that. And as I said earlier, other companies and organizations throughout the county and throughout the region are beginning to do that. So I think that's really important. And let me correct something I said earlier. It's December 1st is the deadline for county employees. I think I said December 6th inadvertently. What I meant, I think I was confusing. August 6th was when we made the announcement about the first time on new hires. So also, I also want to follow up on something that Dr. Bogan said earlier, and it's really about the research and trusting experts. You know, we've entrusted Dr. Bogan to be the doctor of all of us here in Allegheny County, and for good reason. She's got a great career and a reputation as helping people, both as a pediatrician and as a doctor, and in doing research, and we trust her. I certainly not only trust her with myself, but my family. When I decided to get in the trial over a year ago, it was because I believed in what Dr. Bogan was saying. So we put our faith in medical experts, not in some anti-vaxxer on a TV show or on social media. I mean, we have great medical experts here in this region. We're very fortunate with PittMed, UPMC, AHN, and obviously Dr. Bogan and her team. And they have given us very sound medical advice. And it's the medical advice that we ought to take. I know I've taken it, and for my family and friends and others, what she has given and following good sound medical advice. So we want to continue to do that, and we want to continue to rely on the experts that we have put in place in positions of authority and positions of responsibility to keep us safe. Just like we do with Christina Casotis at the airport, or Catherine Kellerman at the Port Authority, or Steve Shanley in Public Works, or Matt Brown at 911, et cetera. We put people in place that really understand what they're doing in their specific area of endeavor, an area of education, and an area of expertise. And I think, again, you want to get good advice, let's take the advice of the medical experts. They'll keep us safe and keep our families safe. So anyway, we look forward to talking to you next week, and let's hope a lot more folks get vaccinated over the coming days. Thank you.
Our next regularly scheduled briefing is Wednesday, October 13th at 4 p.m. Thank you for joining us.